Next, what I would like to speak about allergies. Allergy for pigment. How we can prevent allergies. What do you think about this? Do we need to make an allergy test first? Will it help? Or what is your opinion?
Now, regarding allergies on permanent makeup, it's basically only if you use red shade colors, so it's more like lips tattoo, not really eyebrows. Basically, you cannot really prevent an allergy. You cannot test them in advance. It's not even recommended because we know that allergy can happen months, 2 years after. So the test would be a little tattoo somewhere. You don't really know how much you have to give, when it's going to react, and you can, in theory, even induce the allergy by doing that. Everything goes fine when you do the tattoo, the little dot, and then when you do it, well, that's now you have been stimulating the immunity, so it's not recommended at all. The only contraindication if it's someone who already had a tattoo and a tattoo allergy to the color, then there is a risk that it recurs again. And then if the customer knows perfectly what is the cause, but I would say the pigment or that is responsible for the previous allergy, and you tattoo with another pigment, a different one, in theory you would avoid. But I don't know any case when someone knows perfectly what is the allergy. So basically, in general, if he's allergic to red, you have to explain that you will not be able to do the tattoo using red, pink, orange shades, all these shades, because you have a risk of cross-reaction with the previous tattoo. But otherwise, unfortunately, you cannot prevent, and it should be warned that there is a theoretical risk that the lip tattoo reacts as an allergy.
All right, but what about allergy for anesthetics, for example? Because we use lidocaine, adrenaline, epinephrine, and some kind of liquids before the treatment, and most of the patients, they do not know if they do have allergy or not. Regularly, we ask if you go to the dentist and he does you the injections and anesthetic, and then you're gonna be fine with us, because we do not inject, we only put it topically. So
Topically.
Yes, yes. So we assume that a very small quantity of anesthetic.
Yeah, but the allergies to anesthetic are dangerous if you inject it. So that's not what you're doing.
No.
So the risk of allergy would be rather contact allergy, like an eczema. So, but we do exactly the same as doctors. We do the same when I do anesthesia. When I inject, I only ask the patient, have you had dental anesthesia? They say yes, and then I inject. And if they specifically told me, it's very rare, I think I got allergy to this anesthetic, then of course we don't do the anesthesia, or we use a special anesthetic that doesn't cross-react. But for you, if it's just putting a cream, a numbing cream, should be okay if the question you asked is a patient say that he had no problem.